I'm going to be sharing a little bit about his life, my cousin, Jarrett Speedy Peterson, and talking about mental health. So to kick things off, I am wondering if I could do a show of hands, how many of you have taken a first aid course? CPR, any type of first response? Yeah, a lot of us have. Awesome. Quick show of hands, how many of you have actually used those skills? Have you ever resuscitated anyone or used the Heimlich maneuver? Okay. Fewer, much fewer, but that's great because you're prepared. Not as many of us have been prepared for handling a mental health crisis. Let's do a quick show of hands. How many of you have attended a QPR training or a mental health first aid? A number of people. That's great, that's hopeful. Those are some of the trainings that I provide with my professional lens. My background is K-12 education and school administration, and that has pivoted into the world of mental health. And unfortunately, I came to know those types of trainings when it was too late. Mental health literacy is a big component of the work that I do, the work that we advocate through, and I want to share a little bit of why that's so important to me, why that's become my life's mission, by sharing information about my cousin Speedy. Speedy and I are about a year apart in age. We grew up in Boise, Idaho together. Speedy made Park City his home. He started coming to this area at about 12 years old. He established his own network in an adjunct family. He wanted to become an Olympian. He found himself in the world of freestyle skiing, starting out in ballet and moguls, and eventually finding his home and his passion in aerial skiing. He was on the US ski team for about 16 years. He attended 3 Olympics. He came home from the Vancouver Olympics with a silver medal, and he died by suicide about a year and a half later. Speedy shared his story of his childhood, of his struggles with mental health openly, and so when he passed, as a family and as a network of friends, we decided that it was okay, that he would have wanted us to share his story. Speedy was a hyperactive child. He needed a lot of attention. He needed a lot of outlet. He talked openly about some of the adversities he faced in childhood. He talked about being sexually abused as a child. He lost a sister to a drunk driver when he was 5 years old. He also had an uncle. We shared an uncle who was one of his caretakers as his mom struggled with losing a daughter, and our uncle sadly passed away during the AIDS epidemic. He had a lot of loss at a young age, and so through that loss, he started to find skiing as an outlet. He was able to create that second family, and he really started to excel. He and I were in gymnastics together. We were in tumbling classes together, and he could fly. He was most comfortable flying through the air, and he found this home in Park City in this sport that really gave him the adrenaline rush that he craved. He openly talked to the media about his struggles with mental health. He looked for a diagnosis. He had been diagnosed with ADHD. He knew that he had anxiety and depression, but it didn't all add up. As he continued to progress in his career and he became more elite in action sport, he was struggling. When Speedy passed, Idaho was one of only 2 states that didn't have a suicide prevention hotline call center. This phone number that I have up here, this is the National Suicide Prevention Lifeline. And when he passed 10 years ago, it wasn't a number that I was familiar with. I know I didn't have it programmed into my cell phone as I do now, and I recommend you do as well. When he passed, this was a phone number that Idaho was trying to stand up. This is a phone number that's available in states like Utah, at the University of Utah, where they have an excellent call center. But 10 years ago, that was something that wasn't present in Idaho. And so when he passed, that was the first thing that the Speedy Foundation did, was to help champion and fundraise to stand up a call center. Resources like a hotline where there is a listening ear who is available 24/7, that's free, that's anonymous. It's something that he didn't know about. It was something that his support system didn't know about. It's something that I didn't know about. And I want to share with you that if you don't know about it, it's a resource that can be very, very powerful. You don't have to be the one struggling with thoughts of suicide or self-harm or substance use, addiction. It's a listening ear. I too don't know what to do. but I have a phone number. We can call that number together. We can put them on speakerphone and we can talk it out. We can come up with an action plan with these crisis counselors who are trained. Many of them are volunteers who have been through extensive training with social workers and master's level clinicians that are always available. When Speedy passed away, he struggled with mental health. He had to navigate that system utilizing 911 services, law enforcement, the emergency room. That's how we navigate mental health crises. And that's not how they were developed. 911 is for physical health emergencies and safety emergencies. And yet, we are depending on those systems to help navigate mental health crises. Mental health crises becoming a much more openly talked about topic. We're also seeing through the pandemic that it's something that's progressing and becoming more common. We're experiencing more mental health crises. I want to tell you about how a person gets to that place. When we do outreach booths and through social media, we'll have people approach to say, how could a person get there? How could somebody get to that point where they wanted to end their life? This Venn diagram comes from a researcher by the name of Dr. Thomas Joyner. This is his interpersonal theory on suicidality. He says that a person gets to this place of suicide when they feel like they don't belong. They have thwarted belongingness. They feel alone. They feel isolated. They also feel like a burden. It's a perceived burdensomeness. It's not necessarily true, but it's internally how they feel. It's something that we need help with. We need medical attention when we get to that place where we're desiring suicide. Suicide comes from an unsolvable problem or unbearable pain. People who are desiring suicide don't want to die. They need the pain to stop. They need the problem to be solved. A person can live in that place forever. It can come and go. It's not until they gain the capacity for suicide where they're no longer afraid to die. There's a lot of ways that a person could gain this capacity. It could be that they have had military experience and they've had exposure, or they've had a lot of trauma. What we're now understanding that we didn't understand 10 years ago in the mainstream is that adverse childhood experiences have a scientific connection to shortened life experiences. When Speedy was sharing with the media that he'd been sexually abused as a child, he didn't know anything about that. There was no scientific evidence that said that somehow made his life harder. There is now. 5 years ago, when we started giving mental health first aid trainings, we were just starting to learn about the ACEs study, the Adverse Childhood Experiences study that came from Kaiser Permanente in the 90s. If we know a person's ACE score, if we know that a person has had 3 out of these 10 very common adversities in childhood, we know how to respond to them better and to address that trauma. We didn't know that then, but he was talking about it. It was incredible the way that he was trying to advocate for something that we just didn't know very much about. That capacity for suicide, that can also come from just having access to lethal means, having access to a large quantity of prescription medication, or having access to a firearm. I don't want to say that everything's doom and gloom because there is hope. There is so much that we can do. You don't have to be a trained clinician to be able to respond. We can all learn to respond the same way that everyone threw their hands up when we talked about CPR and we talked about physical first aid. We want to make sure that everyone is mentally covered. We encourage you to visit the Speedy Foundation or another local mental health organization to take a complimentary mental health training. We all can be aware of what those warning signs are. What are the signs that show that someone is struggling? How do we find the right words to say? There's really no right or wrong. We just have to feel empowered to be able to talk about it, to start that conversation. And then we need to be able to connect them to care. We don't have to be the one to solve everyone's unsolvable problems. If we can be that empathetic listening ear, that can do the trick. If we can help get someone connected to a professional, a clinician who can help, get that accurate diagnosis. We want to be living in a society where we can openly talk about that. We need to get people connected to care, to do it quickly, and what we can do as an everyday ordinary citizen, as a family member, as a teammate, as a coach, as a friend, is connect them to care. Know the signs, find the words, and reach out. We can have these crucial conversations. This comes from one of our favorite campaigns out of Australia called Are You Okay? We can always check in with people. Start it. Ask them, are you okay? And then listen. Listen. Sitting in silence might be uncomfortable, but that's sometimes what it takes to help that person not feel so isolated, to not feel like a burden. We need to encourage action. We can't do it ourselves. They need to do it. We can help guide that. We can help facilitate that. And then we check in. It's not a one and done. We circle back and we talk about it. And when we know that someone loses someone that they love to suicide, we talk about it and we check in. The silence that surrounds mental health, that surrounds substance use and suicide, it radiates. And it's part of the problem. It's part of that stigma that we have to change. We have to be in a society where we can talk about it openly, where we explain what's happening. Our support system is open and alert, and they have the ability to connect us to care. What's next? What's now? What happens in the future? 988. I am so excited about 988. This comes into effect in July of 2022. This is going to revolutionize the way that we think about mental health crisis. Just like 911 is for physical health emergencies and safety emergencies, 988 is for mental health crisis. I encourage you, have this phone number programmed into your phone. When this goes online, we will start to revolutionize the way that we respond to mental health crisis. Law enforcement agencies all across the nation are already starting. We have things like mobile crisis units. We have crisis centers. We have law enforcement agencies who are being trained in crisis intervention. These are things that weren't in place 10 years ago. I want you to imagine in the year 2031 that 988 is as common and as prevalent a response as 911. That's what brings me hope. Hope. It's a lofty word. When I think of hope, I think of health outcomes of positive experiences. I think about that adverse childhood experiences study, and I know that a person like Speedy, who had an ACE score of 6 or 7, could have had a lot more interventions if we all understood it, if we knew that we could all help by planting healthy outcomes from those positive experiences, as long as we have healthy culture and healthy communication. Thank you.